So welcome back. The next lecture in the series is entitled Pressure Ulcers, the Clinical Management. You can look at this lecture as being a clinical correlation to the lecture that was just given by Dr. Patty Smith. We're going to talk about some of the more clinical relevant aspects of the management of pressure ulcers. Dr. Smith gave us a very good foundation for understanding the etiology and physiology of pressure ulcers. She talked significantly about the risk factors that place a patient at risk for the development of pressure-related injury, and she talked about the global management strategies, sort of that 60,000-foot view of what we do to take care of the patient in general. What we're going to do in this lecture is we're going to talk about some of the more clinically relevant aspects of the management of pressure ulcer. I'm going to start off talking about some clinical references and resources for you. Then we're going to spend a fair amount of time talking about the staging of pressure ulcers. And then we're going to end with some of the clinical management tools, tricks, pearls, if you will, of managing pressure ulcers related to both the wound care aspects of pressure ulcer management as well as some of the important aspects of pressure redistribution as it applies to the management of these patients. So let's start off talking about what's available out there as a clinical reference and a resource for you. As it turns out, there's quite a bit of information available, and that's actually a good thing. I would like to share with you several of the societies or agencies that are available to provide guidelines and practice algorithms and evaluation of the evidence that tells us how we should be managing these patients, that provides guidelines, if you will, for managing the patients. The first two big organizations are the National Pressure Ulcer Advisory Panel and its sister sitting across the Atlantic Ocean, the European Pressure Ulcer Advisory Panel. These two agencies have worked closely for the past several years, and they're becoming more and more closely aligned on all of their policies and all their publications and all their doctrine.